Doctor, we've talked a lot about the risk to patients who have amalgam fillings. And we've touched a little bit on the people who put them in there or remove them. Talk about the danger to those people, and dentists still use mercury fillings today. How much of a risk is it to the people who are standing over the top of those patients and administering those procedures?
The risk to dental personnel is enormous. There are case control studies showing that women in dentistry are rendered infertile by their occupational exposure 40% of the time. Think about an employer trying to hire a nice young lady to work in this place. Oh, by the way, we'll pay you minimum wage, and don't expect to have any children because they're going to fix that for you. And but infertility, they got studies of dental personnel showing that even ones that have apparently been very minimally exposed to mercury, they have very low levels of mercury in their body, test neurologically impaired. When you actually measure their dexterity, it's declined from where it should be. You select somebody that has really good hands to do your operation, you expose them to mercury, then they got really bad hands. And so, that's no wonder that the work doesn't come out quite like you wanted it. So dexterity, memory loss, short-term and long-term, all kinds of brain-type disorders, and that's the Echeverria study. And she showed very clearly that extremely low levels of mercury are associated with neurological impairment. Well, when you look at the general population, there are people in the general population that have levels of mercury coming out of them that are higher than these dentists that they were measuring. Well, let's measure them. They're just as neurologically impaired. And that's what Vasopotion and Echeverria showed years ago, is that students at the University of Arizona that had the fewest number of fillings tested the best. And they had a few more, they weren't quite as good. And then there were the mercury-free dentists, they were worse. And then the mercury-placing dentists were by far and away the worst. So it's linear. It's the dose, and it causes harm. Now, there are subsets of the population who are genetically predisposed to be harmed by mercury. And those people get harmed at levels that were previously thought to be safe.